Welcome, everyone. We are here today for a webinar on voting from facilities. My name is Kate Bowden. I'm from Disability Rights, Rhode Island, and I will start with some housekeeping for you. This webinar is recorded, and we hope that it will be available to you afterwards for review or for others who missed out on it. Because we are in a webinar format, questions should go through the Q&A box. So if you have questions, put them in the Q&A and those will be monitored, and we will do our best to answer those questions. What you will learn today, you will learn about the law of voting in facilities, and we will try to demystify some of the questions that people have about mental capacity and voting for folks in facilities. And you will also learn about nuts and bolts of how to ensure that your voters in facilities are voting. So our format today will be that in just a few moments, Kathleen Heren will speak to the group. After Kathy, I will give a presentation, a PowerPoint, and answer questions as they come up. Following my presentation, Jennifer Regan from the Board of Elections will give a presentation and take questions as she goes along, and then I will close. So I invite or remind our speakers to mute your mics other than Kathleen Heren, who will speak now. Thank you.
Good afternoon, everybody. How are you all? I'm very pleased that everybody could join today. This is my third year working with disability law on residents' voting rights, and we are now joined very happily with Jennifer Regan from the Board of Elections. So this is a super opportunity for everybody to get trained. I know between the assisted living and the nursing homes, there are lots and lots of new people. For those of you that are not used to working with me and the people in my office, our goal and our mission is to advocate for people for residents and people with disabilities who receive long-term care services. So what are long-term care services? They're for people that live in nursing homes, assisted living, the Bristol Veterans Home, Eleanor Slater, the Regan Building, and also home care and hospice. You're free to contact my office at any time, and we'll be more than glad to help you. I work well with people. And our office is there to train and to help people so that they do the right thing. And we never refuse to answer any questions. Anything that we can do to help, we will. And what I will do in the end is have Lorrena Nardi put our name and our telephone numbers in the way to reach us in the chat box. All right, thank you. Any questions, you can put them in the chat box and Lorrena will give them to me. I'm going to give you back to Kate Bowden now. Thank you.
Thank you so much, Kathy. Now I'm going to try the magic of screen sharing. It's not my superpower, so let's see how this goes. Can you see my PowerPoint? Okay, and it can move, great. So again, thank you all for being here. We really appreciate your time. And what I will do is I'll just take a moment to tell you a little bit about Disability Rights Rhode Island, in case you're not familiar. We used to be called the Rhode Island Disability Law Center, so Disability Rights is our name now. I'll tell you a little bit about us and then get into the law. Classic disclaimer, this is general legal information. If you have specific legal questions, you can certainly call our office at Disability Rights Rhode Island, and if it's appropriate, we would open a service request and take a look. So in terms of who we are, Disability Rights Rhode Island is part of a national network of agencies called Protection and Advocacy Agencies. There is an organization like ours in every state and territory. We are federally funded, and we are a nonprofit. And we are a civil rights organization, so we work to help people with disabilities exercise their civil and human rights. And we do that through legal advocacy and education. Some of the larger systems issues that we are working on, we would like to see the solitary confinement eliminated for people with mental illness in prisons. We are working to ensure that people do not remain in hospitals and institutions too long. We see too many people stuck. We are working to educate the community about supported decision-making, which is an alternative to guardianship. And we have some great resources on our website about that. And we are working to ensure that people with disabilities are able to fully participate in voting. So that's why we're here today. We have a hotline, and you'll hear more about that, but you're all invited to contact us or refer others to contact us if they have questions about voting rights, voter registration, how and where to vote, and more. So I'm going to dive into the law here. There are many laws that apply to people with disabilities, and I will only highlight a couple of them. The Americans with Disabilities Act is it's a very important federal law. It's often referred to as the ADA. Title II of the ADA does a lot of things, but for our purposes, it requires that state and local governments ensure that people with disabilities have a full and equal opportunity to vote. So equal services, and that applies to all aspects of voting. Title III of the ADA applies to places of public accommodation, and that includes nursing homes, assisted living facilities, and other healthcare entities. And Title III contains a non-discrimination clause. So that means these entities are not allowed to discriminate based on disability. So what this means, what these ADA protections do, is it prohibits facilities or the state from categorically disqualifying individuals who have intellectual or mental health disabilities from registering to vote or voting due to the disability. So what that means is a person has a right to register and apply for a mail ballot, and they cannot be denied based solely on disability or diagnosis or guardianship status. And we'll talk some more about that. The other law that I will highlight is the Rhode Island guardianship law. In Rhode Island, guardianships must be limited unless the individual is completely incapacitated. And those who have a limited guardian retain their legal and civil rights, except where those rights have been suspended by a court order. So a person keeps their civil rights, including the right to vote, unless there's a court order which states that the right has been taken away. So I have here some of the language that you encounter on a voter registration form in Rhode Island. The voter has to affirm that they have not been lawfully judged mentally incompetent to vote by a court of law. So this means no court has evaluated the voter's mental ability to vote and made an order taking away their right to vote. If there is no such order, then the person is allowed to vote. So capacity to vote is a question that many people are concerned about when it comes to facilities. And what we know about capacity to vote from the courts, from medical folks, is that capacity is issue specific. So your capacity can differ depending on the issue. You might have a resident who can no longer do their laundry or manage their finances, but they still are very committed to voting and will vote the same way they always voted. Similarly, with capacity to vote, it can differ depending on, it fluctuates. So a person's capacity for daily life may ebb and flow, but their beliefs around voting remain the same. And so the major takeaway from organizations such as the American Bar Association and courts is that only a court is authorized to make a decision about whether a person lacks capacity to vote. And that means it takes the burden off of you all. It means that people in facilities should not be making the decision about whether a person in a facility has the mental capacity to vote. So the consensus is among these experts is that you retain the right to vote as long as you can communicate that you have a desire to vote. And sometimes a person may need accommodations. They might need help to read a ballot or mark a ballot. But if a person is articulating a desire to vote and there is no court order, as I mentioned, then the person is able to vote. And this comes from courts, the Bar Association, the American Bar Association, and the Uniform Law Commission. I'm going to pause there and see if Lorrena has any questions for us.
There are no questions yet.
Okay.
Feel free to put questions in the chat box or the Q&A box.
So I'm going to share, I'm going to try to anticipate what some of the questions might be, or maybe questions that people might not feel sure about asking, with some scenarios here that you might encounter. So the first scenario is you are in a nursing facility, let's say, and there is a resident who would like to vote. However, there is a staff person or a family member who is questioning whether the person is capable of voting. In that case, if the person is legally eligible to vote, meaning there is no court order or other disqualifications such as not being a citizen, but if the person is eligible to vote, they should be asked if they want to vote. And questions about their capacity should not be posed to them, because that is for the court. So the person should be asked to vote, and if they want to vote, they vote. Another scenario that we hear about is where a family member may have a guardian, and the guardian may or they may have a person who claims to be a guardian. We don't know for sure. And the guardian or the person claiming to be guardian says they do not want the resident to vote. This would be a very tricky situation. And in that situation, I would want to see the guardianship order and see what they're relying on to say that the person is not allowed to vote. If there's an order and it doesn't mention that the person is unable to vote, then the resident should be able to vote. And this would certainly be a situation where you could contact my office and speak to me about it and see if this should be a service request to open. I'll give you one more scenario and then move on to the second part of my presentation, and then Jen. You might encounter a situation where you are asking a voter, if they, a resident, if they would like to apply for voting this season, and they might ask you, well, who should I vote for? In that situation, you should do everything you can to avoid influencing the resident. And a good way to kind of deflect and just to make sure they understand that it's up to them is just to say very simply, the choice is yours. You can vote for whomever you want, but I'm not able to offer you guidance on who to vote for. So those are some scenarios that come up. There are others, and we're also happy to address questions going forward. I'm going to get into the right to assistance and then shortly close out and hand it over to Jen. One of the important rights that voters with disabilities have is the right to have assistance with voting. So if we were talking about the polls, a voter would have the right to have a pair of poll workers assist them, or the person of their choice. There is also technology that people could use at the polls. When it comes to facilities voting, which is what we're focused on, a bipartisan pair of supervisors from the Board of Elections will oversee that process. And you'll hear a lot about that from Jennifer Regan. And they provide assistance as needed. And that is by state law. Also important to emphasize with the right to assistance is that the helpers are there to help the person mark the vote, mark the ballot, or possibly read it. The voter must be able to communicate their choices. Voters with disabilities have rights to accommodations in voting. And so you know there are accommodations in Rhode Island, such as large print ballots and braille ballots, which can be requested. Voters with disabilities have a right to file a complaint. The Board of Elections has a complaint process, and the deadline is very short. It's about 90 days. So if a person is complaining that their rights have been violated, you could certainly refer them to our office, and we can provide some education about how that process works. Sample ballots are little known in Rhode Island and a great tool. Sample ballots show the voter what will be on their ballot, these on their own specific ballot. Sample ballots are available to review about 30 days before an election. And this is a great way to prepare for voting. It can be an activity to get residents excited about voting. Those sample ballots can be obtained by the local board of canvassers or from the Secretary of State's website, which I have linked here. So as I'm closing here, I just want to remind you that we do have a hotline, and we can answer many different kinds of questions, including guardianship and voting, voting from hospitals and facilities. Lorrena, do you have any questions?
Yes, some questions have come in. They're
Okay.
in the chat box. I'm thinking we want them in the Q&A box, but they're in the chat box. I'll read the first one. I know you already covered this. I don't know if you wanted to put any more detail into it. What about someone with dementia who does not have the ability to know they are voting? I don't know if there's any more detail you can add on that one.
Okay, so if what I heard is, what if a person has dementia and they do not know they are voting? So in this situation, to be equal to all residents, you will have offered everyone the opportunity to apply for a mail ballot. So let's say the person with dementia said, yes, I want to apply for a mail ballot. And then I'm assuming that on the day, the Board of Elections would come and offer the ballot to the person. If they're not able to make a choice, the process stops on its own, and the Board of Elections staff would make note of it. So if they're not able to make a choice, they won't vote. If they're able to make a selection, then they get to vote, just like everyone else. And it's just important to recognize that diagnosis alone doesn't take away the right to vote. And if the person's not able to communicate a choice or make a choice, then they won't vote. There's no requirement that people vote in every race on a ballot. So the person could start voting and vote for governor and then get distracted or decide they don't want to be involved. And that's okay. The ballot can go in with one race marked. I hope that answers the question.
Okay, there's a few more. Are the PowerPoint presentations going to be available so people can review them again, print them out, share them?
Yes, we will make everything available. We will either have it on one of our websites or send it out to the entire list of people who were invited. And so we will let you know how you can get those.
Okay, great. Another question that came in, how do we know if there is a court order that they can't vote? Even if we ask, they may not always be able to answer correctly.
That's a great question. I would say family usually have a handle on that. If there is a guardian, that could be the process where it would have happened. You would be able to find out through the guardian. And it's actually something that's rather rare. So it would be unusual to find that there is a court order taking away the right to vote. So I would say through family or a guardian is usually how you would find out if the person is not able to tell you.
Okay, another question. Will we be getting a bipartisan pair of workers this year?
I think the answer to that is yes. I see Jen nodding, and she will be talking in depth about the nuts and bolts aspect of this process. So Lorena, do you have more questions, or I could wrap up
I
and
do.
pass it on? Okay.
I believe this is the last one.
Okay.
This person says, I'm new in this role. In my past facility, we did all the voting with our residents on their ballots. Am I correct saying we have people come in to do this with residents? We are only responsible to register the residents. So I guess they're asking about the people, the bipartisan.
Right. I think this will be something that you will learn from Jen, but basically it requires that the voters be registered and apply for a mail ballot. And Jen from the Board of Elections will get into the specifics of that. Am I good to close, Lorena?
That's it for questions right now. Yes.
Okay, I'll just breeze you through that. At the close of this PowerPoint, I have some resources for you, including the guide that included the scenarios that I brought up. There are national resources that may be of assistance to you, and local resources, the number and link to Disability Rights Rhode Island, the Secretary of State's office, and the Board of Elections. And I would just like to close my presentation by thanking you for your time. I invite you to join our mailing list, and please also give us feedback about this presentation at this link or our website. And I will now stop sharing and pass it along to Jennifer Regan.
Hi, everyone. How are you? You should be able to see my PowerPoint. Kate, give me a thumbs up if that is correct. You can see that.
I can see it.
Okay, great.
You might need to click on the presentation so that you can get through the slides.
Yep, I did.
Got it.
So before I start, as Kate said, my name is Jennifer Regan. I'm from the Rhode Island Board of Elections. I oversee the administration of voting in nursing homes, assisted living, hospital situations. Before I get into my presentation, I want to thank all of you that assisted voters in your facilities in 2020. I know that was an absolute nightmare year for all of us, and we greatly appreciate all that you did for your residents. It was very unfortunate that the Department of Health put us all in lockdown and wouldn't allow us access, but we are back to sending bipartisan pairs to your facilities to assist voters in need. So let me go forward. Can you all see that?
Might want to switch to presentation.
We can see it, but we can also see all the other slides in this side.
Yeah.
So you might need to get into,
Yeah, I'm gonna,
yeah, from the beginning, maybe.
how's that?
Perfect.
We're all good? Okay. Technical difficulties. So the term mail ballot and absentee ballot are interchangeable here in Rhode Island. It simply means the voter will not be going to the polls on election day. Ballots brought to the facilities by bipartisan pairs or mailed to voters in a facility are part of the mail ballot process here in Rhode Island. Remember that only registered voters that requested a ballot will receive one. Ballots are not generic. The ballot is voter specific and only intended for the voter that requested it. So bipartisan pairs do not show up at your facility with a bag full of generic ballots to be passed out to your residents. It must be requested via a mail ballot application. By law, anyone residing in a nursing home must have the ballot administered by a bipartisan pair. That means my pair makes an appointment. They come to the facility. The voters are usually brought to an activities room or a voting room, one at a time, and they are issued the ballot. If they are able to mark it on their own, they do so. If they need assistance, they are assisted by my bipartisan pair. When I say bipartisan pair, that means one Republican and one Democrat working together. By assisting, I mean, we may have to read the questions to the resident and they verbally tell us how they would like us to mark the ballot. We mark the ballot for them. We show them that we marked it according to their wishes. We show our partner we marked it according to their wishes. Family members may observe this process, but only with a verbal approval of the voter at the time the ballot is administered. I highly discourage this, not because we're trying to hide anything, but I have been in facilities working with a voter and their adult daughter was present and they started arguing. The mother wanted to vote one way. The daughter said, "Oh, no, 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 Mom, that's not how you want to vote." And an argument ensued. We had to remove the daughter. So we like to keep the confidentiality of the voting process intact, and that's why we discourage family members being present. If they insist, as I said, once we make the appointment, you can let them know, but the voter will be asked, are you okay with this person being present? Voters living in independent living or independent/assisted living that do not need assistance or want the assistance of a person of their choice may have the ballot mailed to them and then they can mark it on their own. Bipartisan pairs are solely to be used for voters that need assistance with the ballot. Anybody that can do it independently should do so. All residents in your facility should be offered the opportunity to participate in voting unless there is a known disqualification, such as lack of citizenship, because you must be a US citizen to vote here in the United States, or a written court order stating the person lacks the capacity to vote. As Kate mentioned earlier, it's extremely rare to have someone that have a court order that states they are no longer able to vote. Clearly, if you're going to be asking somebody that question, you would probably be asking a family member or somebody that has power of attorney over them. That could be a guardian. I would probably direct those type of questions to your administrator to find out. Most of you are activities directors or social workers in your facility, so I think that's something that you should probably pass up the chain. I want you to remember that voters that are in your facility for rehab, they're unable to get to the polls. You should be asking them if they would like a ballot. They certainly have the ability to vote. Voters with intermittent dementia, I know that was, dementia was brought up earlier. I have been doing this for a number of years. I have elderly in-laws and elderly parent. Most of you know that dementia can be caused by lots of things. I know with my mother, she was perfectly fine until about 3 o'clock in the afternoon. And then she would have sundowning. So if she was interested in voting and then expressed an interest in that, she would have been voting earlier in the day. But you do not have the right to determine if that person is medically able to vote. So you ask one of your residents, would you like to vote? And they say yes. My bipartisan pairs makes an appointment. We come, and the day their voter is being issued a ballot, they are confused, they're agitated, they don't understand the process. That's going to be noted. And it will be noted on their oath envelope, unable to vote. The bipartisan pair will sign that, date it, and they will also ask you to sign it. So that means you have a Republican, a Democrat, and an official in the facility saying the person was offered the ballot, but they were just simply unable to vote it. Okay, so you don't need to worry about that so much. You'll be signing it once my bipartisan pairs alert you to that situation. I want you to remember that voters should be asked every time there's an election if he or she would like to vote, regardless of whether it's a local, state, or federal election, or if it's a primary or a general election. I recently sent out manila folders to all 155 facilities and hospitals with step-by-step directions on how to register voters, how to request a primary ballot, how to request a general election ballot. And I also asked that you email me back your name, your facility name, and your direct phone number. The reason being is my staff needs to contact you directly to set up that appointment to administer the ballots once they've been requested. I did get an email back from someone with all that information, and they also said, we don't participate in primaries. We only participate in presidential elections. Well, that was rather disturbing to me. You don't have the right to determine which elections you participate in. You should be facilitating voting in every election that is available to your voters. Most of your residents were born in the 30s, the 40s, the 50s. Most of them, while they were growing up, got most of their information from newspapers or from the local news. That is something that doesn't really occur anymore. So there may not be aware of what is on a ballot, who's running, or that they can even ask for a mail ballot. They don't even know how to go about asking for a mail ballot. So that is why you should be facilitating that, asking them, would you like to have a ballot, providing them with the paperwork so that they can request a ballot. And then my staff will assist them with the ballot. You may not refuse a voter a ballot request if the voter is asking to vote. That is violating their civil rights. Please do not deny them the right to vote. Remember, only a judge can deem a person incompetent. Let's say you have somebody request a ballot, we show up, they have passed away, or they have moved to another facility, they're in the hospital. We certainly don't want you violating anybody's privacy laws. We will simply note that they passed away on the oath envelope. My supervisors will note that, and you will also sign that. If they've moved to another facility or in the hospital and you cannot disclose that information, we'll note that also. So who are the agencies involved in this whole process? There's 3 groups. The first is your Board of Canvassers. They're located in all 39 community, city, or town halls. The boards of canvassers are responsible for voter registrations, cancellations, voter record changes, moving from party to party, mail ballot request, which is what this process is, candidate declarations, and nomination papers. So this is actually going to be your first point of contact when you're filling out paperwork. They work with the Secretaries of State's Election Division. Once they get a request for a ballot in a facility, they enter it into the central voter registration system. The Secretary of State creates the ballot, and it is sent here to the Board of Elections, where we will assign it to a pair of bipartisan pairs. So the only thing that here at the Board of Elections that I do is hire the bipartisan pairs. And I do want you to know that I always look first to poll workers. Those people that work on election day that check you in are great people to work for me, and that I've hired quite a few of them. We also do a background check on all of our workers to make sure that they pass that. And they will follow any protocols that are in your facility. If you require them to wear a mask, they will wear a mask. So if you are looking for a list of voters that are registered in your facility, you're going to contact your Board of Canvassers on that. They are responsible for supplying you with a list. If on the day that we show up and you had 8 people request ballots and we only have 7, you would call the Board of Canvassers with that voter's name, and they'd be able to tell you the reason why you don't have a ballot. We'll be able to figure out and rectify that situation if it means coming back for a second visit. So this was the information packet that was mailed to each facility. It's addressed to the activities/social worker. In some facilities, the social worker does this, and others, it's the activities director. If you have not received that, please check with the person that handles incoming mail in your facility. They may not know what this is or who to give it to. If you still can't find it, you may email me and I will send it to you as an attachment. And my email address, jennifer.regan@elections.ri.gov, is right there on your screen. So what's in the packet? It includes a voter registration form. I included the English and Spanish versions, a primary mail ballot application, and a general election mail ballot application. Voters are required to fill out an application for every election that they would like to participate in. So the primary is September the 13th, and the November election is November the 8th. Directions on how to fill out the application with addresses and phone numbers of all 39 boards of canvassers is also included. You may make as many copies as needed of these items. I only supplied you with one. The packet also includes detailed instructions on how to assist your voters in your facility with registration and mail ballot requests. I highlighted important dates in yellow on the paperwork. I want you to keep this paperwork, guys, so you can reference it again for the November election. All right. When you are requesting mail ballots, please fill in box B with the name of your address and your name of your facility before you make copies. That cuts down on the number of things that you need to fill out with the voter. It's going to speed up the process for you. And please review these instructions. And if you have any questions, feel free to email me. I'm here to assist you. So what are you going to do first after you receive the packet and you review it? You're going to call your board of canvassers in the city or town where your facility is located and ask to be mailed a list of voters registered from your facility address. These are the voters you should ask first if they want a ballot. They have probably voted from your facility in the past. That's why they're on the list. Any resident that's not listed is probably registered at another address, probably from the home that they came from. Check with your local boards of canvassers. With the voter's approval, you may update the registration to the facility address on a registration form. Just make sure it's sent to the local board of canvassers by the due date, and you'll find that in your packet. If the voter wants to remain registered from their former address, that's fine. The law allows for it. But the application for the ballot will need to go to the board of canvassers in the town where your voter is registered from. Why do we allow them to do that? Well, some people are coming into your facility and then going back home. Some people are coming into your facility and they're going to be there forever, but they are under the impression that they are going to be going home at some time. So they may have been actively involved in their community, maybe even an elected official. I had in the 2018 election, I was working with a person who was now in a facility. They had been in their local government for 40 years. They had moved into a facility that was out of the town they lived in. They still wanted to receive the ballot because they knew people who were running. They had a family member that was running. They still wanted to vote for those people, and the law will allow that. But if you're not sure, call the local board of canvassers. They have access to all the state files, and they'll be able to tell you where that person is registered. Registration forms and mail ballot requests may be mailed or delivered to the board of canvassers together as one packet. But remember, the registration date is earlier than the end date to request a ballot. I'm going to go into a little bit more detail and best practices in a moment. So on the screen, I did put a picture of the mail ballot application for the primary. So I want you to know when you receive the list of registered voters, it will have their name and their date of birth, and it's also going to have their party affiliation listed. D is for Democrat, R is for Republican, and U is for unaffiliated. They're neither a member of the Republican or the Democratic Party. A registered Democrat may only get a Democratic ballot. A registered Republican may only get the Republican ballot, but an unaffiliated voter may choose either. If a registered Democrat or Republican wanted to get a ballot from the other party, they would have had to have changed their voter registration 30 days prior to an election. So your voters that are unaffiliated can pick Democratic or Republican, but once they request that ballot, they become a member of that party. Those are party laws. We have what's called a semi-closed primary here in the state of Rhode Island. If you're an unaffiliated voter and you go to the polls and you request a Republican or a Democratic ballot, the parties infer that to mean that you're asking to be a member. You will stay one unless you disaffiliate. We are not allowed to offer the paperwork to disaffiliate unless a voter requests it. Our nursing home supervisors will have that paperwork with them because in the past, some of your residents are very knowledgeable about the process and they will ask to disaffiliate. We will have them sign that paperwork, but we cannot submit it to the Board of Canvassers until after the ballot has been tabulated. Law requires that the ballot be cast and tabulated before that paperwork is processed. Does anybody have any questions? Lorena, has anybody?
Yes, we have just a few.
Okay.
Let's see, is the bipartisan pair vaccinated for COVID?
We are a state agency. We can't require people to be vaccinated. So I don't believe most of our facilities can not allow you in unless you're vaccinated, unless that's different. Somebody needs to tell me that, but they will follow any protocols that the facilities have. But I can't require people to have a vaccination. We are a state agency.
Okay. Another question is if a resident chooses to vote, but they don't want to come down to the private voting area on the day of the election, will the bipartisan pair go up to their room?
The only time that my staff should be going to a room is if the person is bedridden and they are unable to get out of their bed. We cannot be catering to people who just don't feel like it. As I said earlier, I had 154 packets sent out. We have a lot of facilities in the state, guys. We try to do this as quickly and as timely as possible, but state law only allows me 20 days prior to the election to do this. So I highly encourage people to come down to the voting area.
Okay. One more question is, what if a short-term rehab patient asks for a ballot, but then leaves the facility before the voting takes place?
If that happens when my pair comes to the facility, just let them know and let them know that person has left the facility. We don't know where that voter went. They may have gone to another facility. They may have gone home. If that is their case, they requested a mail ballot and then they go to the polls, they will have to vote a provisional ballot. It is then on the onus of finding another way to vote would be on the voter. It is against the law to forward ballots to someone.
Okay, I think that was it for questions for right now.
Okay. So on the form, you're going to fill out box B, your name of your facility and your address. Box A, the name of the resident. Your address will, if they're already registered from your facility, will be obviously the same. And then you need to check off a category. There's 4 categories for voters throughout Rhode Island to choose why they are requesting a mail ballot. Category 1 is for voters shut-ins living at home that need a ballot. Those ballots are mailed directly to the voter. This category does not apply to you. You're never going to check off category 1. So that is for shut-ins living in their homes. Category 2. Most of you who have residents that are voting from a nursing home, you will be checking off category 2. These people live in a nursing home, and some, if not all, will need help in reading, marking, or sealing the ballot in the oath envelope. State law requires that a bipartisan pair of election officials assist this voter. You may have questions from family members saying, oh, well, yeah, I'm going to get a ballot from, for my mother or father, aunt, uncle, whatever the case may be. No, if the person is living in a facility, state law requires that it be administered by a bipartisan pair and then returned here for tabulation. As I said earlier, if somebody wants to observe their loved one voting, we have to have the verbal approval of the voter the day of that voting is occurring. Category 4, this is for those of you assisting voters that are living in independent/assisted living facilities. If the voter has an apartment number, receives mail at that address, comes and goes as he or she pleases, and does not need assistance marking or reading or sealing the ballot into the envelope, you should be checking off category 4. The ballot will be mailed directly to that voter. They can mark it in the privacy of their own apartment. They will then seal it in the oath envelope. They sign it, and they may either mail it back, it's postage paid, or they may they can drop it off in a drop box. Drop boxes are located at every single city or town hall. They are located outside under a camera, and they are open 24 hours, currently 20 days prior to the election. We may be extending that to 30. If you have somebody that is living in an assisted living, let's say it's a husband and wife living in an apartment together, the wife needs assistance, the wife could ask her husband to assist her. They don't need to use a bipartisan pair. It's really only for people that need help marking, reading, and sealing the ballot, and they have no one else to assist them with it. Voters always have the right to choose a person of his or her choosing, unless they are living in a nursing home. So if you have any questions on that, please let me know. But as I said, category 2, it's required that we administer it to somebody in a nursing home, but category 4 can be used for people living in assisted living and independent living that do not need our help. We are not a concierge service. If they can mark the ballot on their own, we absolutely want them to do that. So previously I showed you the application for the primary and the 4 categories. The general election mail ballot application has the exact same thing. I just want to go back quickly on this screen. On that primary, see it says mail ballot application, statewide primary, and it gives you the date of the election. One of these boxes needs to be checked off. If they're a Democrat, you must check off Democrat. If they're a Republican, you must check off Republican. If a Republican wanted a Democratic ballot and they didn't disaffiliate, that request for a ballot would be denied. It's illegal to do that, okay? Your unaffiliated voters have a choice, but once they make a choice, they will become a member of that party. So the application for the November election will be identical to this. It just won't have that party affiliation. At that point, each party's final candidate is on the ballot. So we don't need to pick and choose, okay? 20 days prior to the election, the Secretary of State posts an emergency mail ballot application on their website, vote.ri.gov. This is to be used for voters that arrive at your facility after the regular mail ballot request period has ended. You use this for that purpose only. Do not use this for all your residents' requests, because that's not what it's intended for. You should use the regular mail ballot application and have those turned in prior to the emergency period. This will give us more time to make an appointment and come to your facility and administer ballots. Emergency mail ballot applications are for residents who have recently moved into your facility or somebody who's there short-term for rehab, right? If you use this, it's going to leave us little to no time to schedule an appointment to assist your voters. I can assure you, with unemployment as low as it is, it's very difficult to get people to come and assist your voters. As I said, I really rely on people that work the polls, but some of them have, for various reasons, decided they're no longer doing it. Make copies of all your paperwork. So once you've filled out a mail ballot request form with a voter, make copies and put them in a binder so that when we call and make an appointment, you know which residents you need to have available the day that we are coming. You can use that list as a starting point for future elections. Oh, who voted last time? Let me see if they're interested this time. I also suggest that you let the nurse or the CNA that works with that resident know the date or time that voting will be occurring, so that resident's in the building and ready to vote. We do limit the times that we come, usually to 9 to 4. We will work around your schedules. We don't come nights. We don't usually come weekends, guys. We will come after bingo. We don't want to come early in the morning because you're getting your residents up and dressed and starting their day. We also don't like to come in late in the afternoon. We want to not upset what we know is a very structured schedule in your facilities. So get your paperwork in early. This is a very important slide. I will share my PowerPoint with all of the facilities and you can get a copy of it, but this is very important. The registration deadline for the primary is 8/14. So if you have somebody that's not registered in the state of Rhode Island, or somebody that's going to be in your facility for the remainder of their days, and they're now going to be registered from your address, that paperwork needs to be in by 8/14. The request for mail ballots, the deadline is 8/23. I'm going to suggest you complete the registration and the applications at the same time and turn it in by Friday, 8/12. And there's 2 reasons. You haven't missed the registration date. You've now put your requests in for ballots to be brought to your facility for your voters. The minute those get entered into the system, I can see you have voters that are going to be voting. I can have my staff call you ASAP to set up a date. You have a whole range of dates then to choose from, and we can put it on our calendar and you can put it on yours. Remember, we cannot start until 20 days beforehand. So if you get it in by that 12th, both the registrations and the mail ballot request forms, they get processed by the Board of Canvassers sooner. I get the ballots sooner, my staff can get to you. I know in 2020, we were getting phone calls after phone calls, where are the ballots, where are the ballots, where are the ballots? If you wait to the last minute to request them, the input, it can take a little bit longer, because remember, thousands of other voters in Rhode Island are requesting mail ballots also. And then the ballots need to be made and then delivered here. So it's not something that occurs. I don't have ballots here. We don't have any ballots here at the Board of Elections. We process voted ballots here, all right? For the November election, the registration deadline is October 9th, and the mail ballot registration deadline is 10/18. And I suggest that you complete registrations and requests for ballots by 10/7. Obviously, if you have people that come into the facility after those dates, you could still process an application for them, but I would like the bulk of your people already done so that I can assign a pair to you. The sooner you turn in your paperwork, the sooner it's processed, and the sooner you're going to receive a phone call setting up a date, and then you have way more choices on dates. If you put it in late, you're going to be stuck with whatever my staff does not have blocked off. All right. If you have any questions on that, feel free to put anything in the chat. So Lorrena, is there any questions right now?
There are a few. I think this one you may have already answered with the emergency ballot. What if you have a short-term resident that came to the facility after registration was completed?
So somebody who's coming to your facility for short-term for short-term, let's say they had a hip replacement or something, they're just there for rehab. You don't need to register from the facility. They're not there forever. They would fill out in box A their name and their home address. Box B is your facility address because that's where the ballot is going. So somebody who's only there temporarily, you're not going to be re-registering them to your facility. They may stay registered from their domicile.
Okay, another question is, what do you advise we do if the resident requests a ballot from us and we discover that a family member has also helped the resident request an absentee ballot?
I would certainly let your, for family members should not be doing that. Now, the Board of Canvassers know that if it's checked off category 2, it's absolutely coming here. You don't want to duplicate something. If you have residents that are requesting ballots or you're going to be working with them to fill out the paperwork, I would certainly let family members know. Let your administrator, if you don't have contact with the family members, let your administrator know, hey, these people have requested ballots. I just don't want their family to duplicate them. It's important to do that. Family members think they're being helpful, and they fill out the application for their loved one. And what they don't realize is that we match signatures. So when your residents request a ballot, they're filling an application and they're signing it. When it goes to the Board of Canvassers, the Board of Canvassers are going to compare the signature on the application to the voter's registration. That probably, because of the age of your residents, will probably be a wet signature. That means something that was signed on a piece of paper. If it doesn't match, that request for a ballot is denied. So family members think they're being helpful. They also think if they have power of attorney that they have the right to cast a ballot for their loved one because, you know, they know how they want to vote. Power of attorney covers everything but voting. Only a voter may cast a ballot. So if you do have people, asking to vote and their family members come in, hey, let them know. Please do not request a ballot for your loved one. We have completed the paperwork with them. Their ballot will be brought here by a bipartisan pair and administered by a bipartisan pair. Anything else?
Yes. This one is, will you come more than once for residents that were not available on the scheduled day?
So what happens, we know that sometimes people all of a sudden have to go to a doctor's appointment or to the hospital, they're out of the building. My staff will note out of the building and will make another appointment to wrap up those voters. I want you to know that we can do this process until 8 o'clock election day. So we want to get the bulk of your voters out of the way. And if we have to come back another time later on, closer to election day, we will absolutely do that. But let's try to get as many people in one fell swoop. It's easier on you. And it certainly gets a little bit harder as we get closer to election day, but we will definitely get people back there. We will never let somebody who wants a ballot not get one.
Okay, so one last question right now is, what if a resident requests a ballot in another language?
Okay, there's only certain communities that have English or Spanish versions. And that would be Providence, Central Falls, Pawtucket, and Woonsocket. Those communities have a certain percentage of population that are second language Spanish speaking. And that is when the law kicks in and says you have to offer it in another language.
Okay, that's it for now.
Community. So if somebody was, let's say, in Cranston, that's not to say we couldn't get one, but if it came in English, it's because that's the only ballot that's available in Cranston. They don't meet the Department of Justice criteria to have it in another language. Okay.
That's it for questions right now.
Okay. So best practices, I'm almost done, guys, I promise. The most successful voting days are days that are planned. I've seen some fabulous things at facilities, and you guys are rock stars as far as I'm concerned. Plan on bringing your voters to the voting area in a timed manner. So if you have a 3-story building, floor 1 comes down first, then floor 2, then floor 3, and plan on each voter being given a 10-minute time slot. Decorate your voting area with red, white, and blue. Make it an event. I had a facility that was fabulous. They had it all decorated, and every time that the resident, after they completed the voting process, one year they had M&M cookies, and it was red and white M&Ms. And then one year, the next time was in 2018 when I was there, they had cupcakes with red, white, and blue sprinkles. Please keep in mind that voters that are bedridden will be administered the ballot last, but don't forget to include those voters in the festivities. Just because they couldn't come down doesn't mean they shouldn't enjoy the process also. I cannot supply you with sample ballots. That's not something the Board of Election has. Ballots are still being made. Right now, people that have declared for office have to get a certain number of signatures for their names to be placed on the ballot. They have until Friday to obtain those signatures. Those are then turned into your local boards of canvassers. They verify that these signatures are actual registered Rhode Island voters. Once they verify those, then the ballots are made. So sample ballots will not be available until probably the first week in August. So if you're looking for those for your city or town, you would have to contact your local board of canvassers probably that first week, and they'd be able to get those to you. Other than that, guys, I am pretty much done. I just, once again, I want to give a word of thanks. I'm very aware of all that you do for your residents. I have been into many facilities. I know this can be a very confusing process to add to your already heavy workloads. Thank you for all that you do for your residents, especially those that are interested and engaged in this very important democratic process. Your hard work is greatly appreciated. As always, if you have any questions about the packet I sent you or that you didn't receive it, my email is jennifer.regan, R-E-G-A-N, @elections.ri.gov. And I am going to stop sharing and turn this back over to Kate Bowden unless there's any other questions.
There was one question that just came in. How do you check if a person is a US citizen?
So when people are registered, they are required to check off a list of things on a box, that they're over the age of 18, that they are a US citizen, that they are not mentally incapacitated. There's a list of questions they have to check off. Most people now are registering either at the DMV or on vote.ri.gov. When you register at the DMV, you have to prove who you are to get a driver's license via a birth certificate or a US passport, naturalization papers. There's a whole long list. In order to register online using vote.ri.gov, you must have a Rhode Island driver's license or a Rhode Island ID. In order to obtain either of those, you had to provide proof of your identity. So that's how that's done.
And just a couple of more comments that had come in regarding the vaccination status of the bipartisan people that will be going into the facilities. A couple of people commented that if they're not vaccinated, they will need to have like a negative rapid test, so that if you have non-vaccinated workers going in to assist with voting, they might want to check with the facilities prior to going in.
So what I'm going to do is highly recommend vaccinated and boosted people apply, but I can't I cannot not hire somebody for that reason. We're a state agency. I'm going to highly recommend it. I will let people know if they're interested, because people usually fill out an application and then I contact them. As I said, most of my hires are people that already work in the polls, are familiar with it, but I do a meet and greet with them, and I'll let them know, listen, if you are not vaccinated, you may have to show a rapid test within 24 hours of going to the facility, and you'll be required to wear a mask. Most likely that's going to weed out people that from the whole process. So on my application, I'll put, highly recommend that you are. Because of the nature of, the facility, we don't want to get our older voters sick or exposed to anything. Okay, if there's nothing else, I'm going to stop sharing and give it back to Kate. Thank you very much, guys. I appreciate your attention.
There is one more question. This person said, I have residents without IDs.
Your residence identification has been verified when they were admitted into your facility. So they don't have to show us IDs. That their identity has been already vetted by your administration when they entered your facility.
Is that it?
That's it. Yeah. There's no
Well,
other questions.
I just want to thank everyone so much for being here, particularly our speakers and all the attendees. And I will note that we have, I believe, in the chat a link so that folks can give us feedback on this presentation. We really appreciated having you here. We thank you for everything that you do. Do please provide us feedback. We thank you, and this concludes the webinar for today.